Good morning, everyone. Welcome to the Health Breakdown. Thank you for being here today. I'd like to take a few moments to speak with you about something that affects millions of people across the world every single day: alcohol. Specifically, what alcohol does to your body, your brain, and your overall health. Let's begin with a simple truth. Alcohol is a powerful substance. It can bring short-term feelings of relaxation or euphoria, but beneath those temporary effects lies a much more serious and long-lasting impact on your health. Certainly, here's an approximately 500-word expansion of the key point: alcohol damages major organs, written as a smooth paragraph without any headings. Alcohol, when consumed, travels quickly through the bloodstream and reaches almost every part of the body, placing a considerable burden on several major organs. The liver, in particular, is one of the most affected. It is responsible for breaking down and metabolizing alcohol so it can be eliminated from the body. However, the liver can only process a certain amount of alcohol at a time, and excessive drinking overwhelms this process, leading to a buildup of toxic byproducts. Over time, this can result in fatty liver disease, which may progress to alcoholic hepatitis, fibrosis, and eventually cirrhosis, a serious condition where healthy liver tissue is replaced with scar tissue, impairing the organ's ability to function. Cirrhosis is often irreversible and can be life-threatening, requiring a liver transplant in severe cases. But the damage doesn't stop at the liver. The heart is another organ that suffers from excessive alcohol use. While some studies suggest that moderate alcohol consumption may have cardiovascular benefits, such as raising good HDL cholesterol, these benefits are far outweighed by the risks when alcohol intake is frequent or excessive. Heavy drinking can lead to high blood pressure, irregular heartbeat or arrhythmias, cardiomyopathy, a weakening of the heart muscle, and increased risk of stroke and heart failure. Over time, alcohol weakens the heart's ability to pump blood efficiently, putting strain on the entire circulatory system. The pancreas, too, is affected by alcohol. This organ plays a critical role in digestion and blood sugar regulation. Alcohol can cause the pancreas to produce toxic substances that lead to inflammation, a condition known as pancreatitis. Pancreatitis can be acute, coming on suddenly and severely, or chronic, persisting over time and causing lasting damage. In either case, it can be extremely painful and dangerous, sometimes requiring hospitalization or surgery. The digestive system as a whole is not spared. Alcohol irritates the lining of the stomach and intestines, which can lead to inflammation, ulcers, and bleeding. It interferes with the absorption of nutrients and can damage the cells in the gastrointestinal tract, increasing the risk of digestive cancers. Chronic alcohol use also weakens the immune system, making the body more susceptible to infections, including those affecting the lungs and other vital organs. In addition, long-term alcohol consumption has been linked to damage in the kidneys, which are responsible for filtering waste from the blood and regulating fluid and electrolyte balance. Alcohol's diuretic effect, causing increased urine production, can lead to dehydration and strain the kidneys over time. Taken together, these effects show that alcohol doesn't just have temporary consequences, it causes real, progressive, and sometimes irreversible harm to the body's major organs. What starts as a drink to relax or socialize can, if consumed excessively and frequently, evolve into a serious health risk with lifelong consequences. Alcohol has a powerful and immediate impact on brain function, affecting the way the brain communicates with the rest of the body. Even in small amounts, alcohol begins to interfere with neurotransmitters, the chemicals responsible for sending messages between nerve cells. One of the most affected systems is the gamma-aminobutyric acid GABA pathway, which slows brain activity and produces a calming effect. This is why people often feel relaxed or less inhibited after a drink. However, as alcohol consumption increases, its effects become more disruptive. Coordination, reaction time, decision-making, and memory all begin to deteriorate. This is why intoxicated individuals often exhibit poor judgment, slurred speech, clumsiness, and memory blackouts. These are not harmless short-term side effects. They are clear signs that alcohol is interfering with the brain's ability to function normally. The impairments become even more severe with chronic or heavy alcohol use. Over time, the brain begins to adapt to the constant presence of alcohol by altering its structure and chemistry. Certain areas of the brain, particularly those responsible for executive function, emotional regulation, and memory, such as the prefrontal cortex and hippocampus, can shrink or become damaged. This can lead to long, lasting, or even permanent changes in personality, behavior, and mental performance. Chronic alcohol use is also linked to a condition known as alcohol-related dementia, where an individual suffers from cognitive decline similar to Alzheimer's disease. Another serious condition is Wernicke-Korsakoff syndrome, often referred to as wet brain, which is caused by a deficiency in thiamine vitamin B1 and primarily affects people with long-term alcohol dependence. It can lead to confusion, memory loss, and an inability to form new memories. One of the more dangerous effects of alcohol on the brain is its ability to impair impulse control. The more a person drinks, the more their decision-making becomes compromised. This often results in risky behaviors, such as unsafe sex, reckless driving, or aggressive outbursts, actions that may have severe consequences, both physically and socially. Alcohol can also lower inhibitions around self-harm or suicidal thoughts, particularly in individuals who already struggle with mental health challenges. In younger individuals, particularly teenagers and young adults, the brain is still developing, and alcohol use can cause more extensive and long-lasting harm. Drinking during these critical years can interfere with brain development and increase the risk of developing alcohol use disorder later in life. Moreover, heavy alcohol use at a young age has been associated with decreased academic performance, behavioral problems, and long-term deficits in learning and memory. Ultimately, alcohol's impact on the brain goes far beyond a temporary buzz. It alters brain chemistry, disturbs cognitive functions, impairs emotional control, and can even change the physical structure of the brain itself. These changes can lead to serious mental and behavioral health issues, some of which are irreversible. While moderation may lessen some of these risks, excessive or prolonged alcohol use is undeniably harmful to the brain's short-term and long-term functioning. Alcohol's impact on mental health is often complex and multifaceted, with both immediate and long-term consequences that can worsen existing conditions or create new challenges. While many individuals drink to unwind, cope with stress, or escape from difficult emotions, alcohol's effect on the brain and body can ultimately exacerbate these very issues, leading to a vicious cycle of mental health deterioration. One of the most significant ways alcohol affects mental health is by directly altering brain chemistry. Alcohol is a depressant, meaning it slows down the central nervous system and impairs cognitive and emotional regulation. In the short term, this may result in feelings of relaxation, euphoria, or a temporary sense of relief from anxiety or sadness. However, as the effects of alcohol wear off, they are often replaced with a rebound effect, heightened anxiety, irritability, or depression. This cycle can lead individuals to drink more frequently or in larger quantities, hoping to regain the temporary relief alcohol provides. Unfortunately, the more alcohol is used as a coping mechanism, the greater the potential for developing mental health disorders such as anxiety and depression. Over time, heavy or prolonged alcohol use can contribute to the development or worsening of more severe mental health conditions. Chronic alcohol consumption disrupts the balance of neurotransmitters in the brain, including serotonin, dopamine, and GABA, which are responsible for regulating mood, behavior, and emotional responses. As alcohol reduces serotonin and dopamine levels, it leads to feelings of hopelessness, sadness, and emotional instability. This can increase the likelihood of developing mood disorders like depression and anxiety disorders. In fact, people with alcohol use disorder are significantly more likely to suffer from major depressive disorder and generalized anxiety disorder than those without alcohol dependence. Alcohol also plays a significant role in the increased risk of self-destructive thoughts and behaviors. As alcohol impairs judgment and impulse control, individuals under its influence may be more likely to act on feelings of hopelessness or despair. This can lead to suicidal ideation, self-harm, or risky behavior, particularly in those who already struggle with underlying mental health issues. Alcohol is known to lower inhibitions and may cloud the individual's ability to seek help or recognize the severity of their emotional distress, making the situation even more dangerous. Moreover, alcohol often serves as a temporary solution to underlying mental health issues, but it never addresses the root causes. It's not uncommon for individuals with anxiety, depression, or trauma-related disorders to turn to alcohol as a means of self-medication. While alcohol may provide immediate relief from these painful emotions, it does nothing to resolve the underlying issues. Over time, this pattern of drinking to escape emotions or stress can lead to alcohol dependence or addiction, further entrenching the individual in their mental health struggles. The effects of alcohol on mental health are not confined to those who drink heavily or have an alcohol use disorder. Even moderate alcohol consumption can contribute to heightened emotional instability or exacerbate feelings of anxiety, particularly in individuals who are predisposed to mental health issues. What begins as occasional drinking can quickly escalate into a regular habit, potentially turning into a destructive cycle that impacts relationships, work, and personal well-being. Ultimately, alcohol and mental health are inextricably linked. While it may seem like alcohol provides temporary relief from emotional pain, its long-term effects often lead to more severe and persistent mental health problems. Understanding this relationship is crucial for breaking the cycle of self-medication and seeking healthier, more sustainable ways to manage mental health challenges. The short-term and long-term health risks of alcohol consumption are wide-ranging and can affect virtually every system in the body. Whether someone is drinking occasionally or regularly, it's important to understand that the consequences of alcohol use are not confined to just one area of health. They span across both immediate dangers and more chronic, long-lasting issues that accumulate over time. Even though many people may think of alcohol as a harmless way to unwind, its effects on the body can be far more serious than they may realize. In the short term, alcohol consumption has immediate impacts on the body and behavior. One of the most common risks is the impairment of judgment and coordination. Alcohol acts as a depressant, slowing down the central nervous system, which can make it difficult to think clearly, react quickly, or make sound decisions. This increases the likelihood of accidents and injuries, whether it's from falls, car accidents, or other risky behaviors, like unsafe sex or aggression. These immediate dangers are often exacerbated when alcohol is consumed in large quantities or rapidly, leading to alcohol poisoning, a serious and potentially fatal condition. Alcohol poisoning occurs when the body's ability to process alcohol is overwhelmed, leading to symptoms like confusion, vomiting, seizures, slow or irregular breathing, and loss of consciousness. In these cases, medical intervention is crucial. In addition to accidents and injuries, alcohol can cause other short-term health issues. For example, heavy drinking can lead to dehydration, as alcohol is a diuretic, meaning it causes increased urination. Dehydration can result in headaches, dizziness, nausea, and fatigue. Moreover, alcohol irritates the stomach lining, which can lead to gastritis, inflammation of the stomach, acid reflux, and in some cases, vomiting or even gastrointestinal bleeding. These effects, while often temporary, can still have serious consequences, particularly for individuals who drink heavily or frequently. The long-term health risks of alcohol use are even more concerning and can result in irreversible damage to the body. Prolonged or heavy drinking is strongly associated with an increased risk of developing chronic diseases, including cardiovascular problems like high blood pressure, heart disease, and stroke. Alcohol has a direct impact on the heart, weakening the muscle over time and leading to conditions like cardiomyopathy, where the heart becomes enlarged and struggles to pump blood effectively. Regular alcohol use can also lead to arrhythmias, or irregular heart rhythms, which can increase the risk of stroke or heart failure. Beyond the heart, alcohol also poses a significant risk to the liver. Chronic alcohol consumption is one of the leading causes of liver disease, including fatty liver disease, alcoholic hepatitis, and cirrhosis. The liver is responsible for processing and eliminating alcohol from the body, but when it is overburdened with alcohol over time, it becomes inflamed, damaged, and unable to function properly. Cirrhosis, which is a result of prolonged liver damage, can lead to liver failure and may require a liver transplant. Furthermore, alcohol abuse increases the risk of several types of cancer, particularly those of the liver, mouth, throat, breast, and colon. Long-term alcohol use also has a significant impact on mental health, as it contributes to the development of disorders such as anxiety and depression. While alcohol may initially provide a sense of relief or euphoria, its depressive effects can lead to a worsening of mood and emotional regulation over time. Chronic alcohol use is also linked to cognitive decline and can lead to alcohol-related dementia, particularly in those with alcohol use disorder. It is also important to note that alcohol use is often linked to poor lifestyle choices, such as poor diet, lack of exercise, and disrupted sleep patterns, which can further increase the risk of other health complications. In conclusion, alcohol presents a wide array of health risks, both short-term and long-term, that can affect physical, mental, and emotional well-being. While occasional drinking may have limited impact, frequent and excessive alcohol consumption significantly increases the risk of serious conditions that can compromise the quality and length of life. Being mindful of these risks and making conscious choices about alcohol consumption is essential to protecting one's overall health. Awareness and moderation are fundamental concepts when it comes to understanding alcohol's effects on the body and mind. With alcohol being such a prevalent part of social culture, many people may not fully comprehend the long-term impact it can have on their health. It's easy to dismiss the risks when the effects aren't immediately visible, but understanding the balance between responsible use and the dangers of excessive drinking is critical for leading a healthy life. Awareness is the first step toward making informed decisions about alcohol consumption. Many people drink socially or as a way to unwind after a long day, often without considering the potential harm that could be accumulating over time. Alcohol's effects are not always immediately apparent, especially when consumed in moderation, but over time, these effects can compound and lead to serious health issues. For example, one of the key challenges with alcohol is that it can be difficult to recognize the fine line between moderate consumption and excessive drinking. What starts as an occasional drink or a glass of wine with dinner can quickly become a habit, leading to unhealthy drinking patterns. It's important to be honest with oneself about the frequency and quantity of alcohol consumption and to recognize the potential signs of dependence, such as needing to drink more to achieve the same effect or feeling an inability to cut down. Awareness also extends to understanding how alcohol interacts with different individuals. Factors such as age, weight, gender, and overall health can all influence how alcohol is processed by the body. For instance, women generally metabolize alcohol more slowly than men, which means they may feel its effects more quickly and intensely. Individuals with certain medical conditions, such as liver disease or a history of mental health issues, may be more susceptible to the negative impacts of alcohol, even at lower levels of consumption. Recognizing these factors and tailoring one's drinking habits accordingly can go a long way in minimizing harm. Moderation is equally important in mitigating the risks associated with alcohol. The concept of moderation varies by individual and cultural context, but there are established guidelines that can help inform responsible drinking. For example, the Centers for Disease Control and Prevention (CDC) defines moderate drinking as up to 1 drink per day for women and up to 2 drinks per day for men. It's also essential to understand that 1 drink is defined as a 12-ounce beer, a 5-ounce glass of wine, or 1.5 ounces of distilled spirits. These guidelines are not meant to encourage drinking, but rather to provide a standard for understanding what constitutes safe consumption. Drinking within these limits helps to prevent the body from being overwhelmed by alcohol's toxic effects and minimizes the risk of developing chronic health problems, such as liver disease or heart conditions. Moderation, however, doesn't mean that heavy drinking is safe in small intervals. Binge drinking, or drinking large amounts of alcohol in a short period of time, is a dangerous pattern that can lead to alcohol poisoning, accidents, and long-term health consequences. Even occasional binge drinking can increase the risk of developing alcohol-related problems. It's important to recognize that alcohol's impact on health is cumulative, meaning that over time, even moderate drinking can increase the risk of issues such as liver damage, high blood pressure, and mental health disorders. The goal is to balance enjoyment with health by adopting a responsible approach to alcohol. For some individuals, complete abstinence may be the best choice, particularly if they have a history of alcohol abuse or are struggling with mental health conditions that alcohol may exacerbate. For others, moderation, awareness, and mindful drinking can ensure that alcohol remains a safe and enjoyable part of life without leading to harmful consequences. Ultimately, being aware of the risks in drinking in moderation is not just about following guidelines, but also about recognizing the broader impact alcohol can have on one's health. Regularly assessing drinking habits, being mindful of physical and mental well-being, and seeking support when needed are key steps toward making informed decisions. By fostering awareness and practicing moderation, individuals can reduce the negative effects of alcohol and lead healthier, more balanced lives.